All right, so I've been thinking a lot about fat grafting. I think fat grafting is something that we don't do well in plastic surgery. What is fat grafting? Well, maybe one of the most common areas that we see fat grafting, that we use fat grafting, is either for breast augmentation or for reconstructive breast surgery. In either case, what you're doing is you're liposuctioning for maybe the hips, the thighs, the tummy, the love handles, and you're processing that fat and you're re-injecting it to improve volume. It's a very natural augmentation, allowing us to avoid implants to perform an augmentation for patients. But one of the main problems with fat grafting is the fat goes away, about half the fat goes away, and it can become hard. That's known as fat necrosis. Those are real problems with fat grafting. So I've been thinking a lot about how do we make this process better? And I've been thinking of it in terms of seeds and soil. So just bear with me for a second. So to get seeds to germinate, you need really good soil, but you also need really good seeds. And I think it's very similar with fat grafting. You need good fat, you need to be able to put it somewhere that's good soil, that's got a good blood supply. So we've developed a lot of techniques to really optimize how we treat the fat and where we place it into the tissue and how we optimize the tissue. And what's allowed us to do is really increase our rates of success to beyond 85%, even 90%. So we have a much lower risk of fat resorption, of oil cysts, of fat necrosis forming. So if it's something that you're interested in, I'd love to talk to you about fat grafting because I really think there's a real opportunity to make this thing better for patients and better in general.